Hey everyone, it is Monday night. Yeah, it's been a great day. Gosh, I've had so much fun today. I've done a lot of research and so I'd had some things on my mind about heart disease because here's what I know that you may not know, but heart disease is the #1 killer of women, coronary artery disease. And so I want to talk about today a detector of heart disease. In fact, it's the #1 modality that is recommended now. I listened to several cardiologists today from Mayo, from different high level, I guess you would say, heart institutes. And so I want to share that with you in a few minutes. But first, I want to share what I did for supper tonight. And so I'm not going to cook all of it, but I did want to show you how I do my meatloaf because, and actually I posted that video in the group, in the challenge group today. But look at this. This is meatloaf, and this meatloaf has kale and spinach in it, okay? And some onion and some celery and some Italian seasoning and a couple of eggs. I don't put any bread in it. And then this is a delicious cauliflower casserole that honestly I'd rather have it than macaroni and cheese any day. So if you want that recipe, you need to send me your email and I'll send it to you. But if I don't have your email, you won't get it. But honestly, it's cauliflower. It's totally keto. Cauliflower, sour cream, eggs. I used onion powder and garlic powder instead of onion and garlic tonight just because I was in a hurry, and honestly, nobody could tell the difference, okay? So anyway, delicious meal, totally. This is, of course, kale that I sauteed in some avocado oil. I squirted some lemon in it, covered it, and let it simmer and just get tender. So, let me go ahead and show you how I do my meatloaf. All right, I'm going to have to get a paper towel to clean my hands off when I get done. Hold on. I'm coming back. Okay, so here we go. So this is what I did earlier in the food processor. I'm not going to go through the recipe. Just a couple of tips I want to show you. I did a bag of spinach, a small box of spinach, a couple of eggs. I did an onion, some green onion, some red pepper, and this is actually two pounds of hamburger meat. So I'm going to put a piece of parchment paper on my pan here, and some coconut aminos, salt and pepper. You can see there's a lot of greens in here, a lot of green stuff. So I make it up. I don't make mine big because I want it to cook pretty quick. I don't want to have the oven on. All right, here you go. This was I guess it was a piece of hamburger. All right, so, and of course salt and pepper and Italian seasoning, and I guess that's it. So about a half an onion and about 4 green onions. All right, so I'm going to try to get them equal size, but sometimes it doesn't turn out. So this was actually an Emeril Lagasse recipe for, and he put zucchini in it, but I put spinach. And then I just take my finger and I poke holes in it, and that's just to let it cook through. And then I cook it, of course I preheated my oven. I cook it on 425, okay, for about, until it's done. And then right near the end, I actually take some ketchup and some mustard, put it together, and maybe a little maple syrup, but probably not. And I didn't tonight. You see, that's the topping on it. And put it on there, and then let that brown really good for 7 or 8 minutes. And that's ready to go. So I think I'm going to stick that in the oven in a minute. But I want to tell you, I left off a secret ingredient. Let me tell you the secret ingredient is mayonnaise, avocado mayonnaise. I put about 2 tablespoons in that. And what it does, it just adds some fat. Of course, the meat that I used was organic grass-fed beef, and it has it's 85%, so it does have a good bit of fat. But I like it really to be tender and juicy, and I don't want it to be dry. And so you don't pack it down. If you pack it down and pat your hamburger out a lot, then it gets too compressed, doesn't have any air in there, and so it's going to be tough and dry. But I don't do that. Okay, so I want to talk to you about something, probably the most serious thing I'd ever talk to you about. So you see this tube of lipstick right here? All right, there's something different about this tube of lipstick. I mean, yeah, it's a tube of lipstick. Yeah, put on lipstick, okay? But what's different about this tube of lipstick that I didn't know for the longest time is it has a mirror on the side of it. Yeah. And so I'm like, whoa, how cool is that? But I didn't know, so I couldn't use it. I couldn't take advantage of it. Yeah, it's one of those free gift things, from Estee Lauder. Okay, so, but now I know, and I can use it to help myself, to get my lipstick on straight without having to walk into the bathroom. So what I'm about to tell you is probably something you don't know. In fact, there's probably a lot of things that I tell you that you don't know. And I'm not that I'm that smart, but I'm constantly, it's the field I'm in. I'm constantly researching to help my clients and to help people. Because my goal is to take you from point A, which is not really knowing how to help yourself, and what good, wholesome nutrition is, to point B, where you know what healthy nutrition is. I signed up a girl today. She is type 1 diabetic, and she said, I had no idea. She said, I eat oatmeal every morning, or a lot of mornings. I ate sausage biscuit thinking that was good because it's not pancakes, eating crackers, things, and then she just, takes insulin. But today she got 2 hours worth of education, and she joined my program, and she's going to be able to lower her insulin and possibly come off of her insulin. And she's type 1, okay? It is possible. And so that's why I want you to follow me. I want to get your email. I want to add you to my email list, because every few days I send out an email. I spent at least 4 to 5 hours today watching videos from doctors, nephrologists, cardiologists, to bring you the correct information. So I'm not just spouting out information. I'm actually researching. So I call myself a funnel. I'm out there finding the information and funneling it to you, which is what a good teacher does, a good coach, all right? So I want to have the right information. So email me if you have questions, or text me. I'd love to help you. All right, so let's get to this. All right, so I told you what I was going to do is tell you the best modality for determining if you have heart disease. And this is really for women under 65. So if you're over 65, your doctor may want to do one of these tests, or he may have already done one of these tests. Typically, it's not done for women over 65, but it's a detector of calcium in your plaque in your arteries, okay? And it's called the CT calcium scan. Cost about $99. I had one last fall, and mine was below 100. I mean, I had a really good score, which I was glad to know, because my cholesterol has always been, not always, but it's been a little elevated. So, the doctor was concerned. I wasn't concerned because I know I eat healthy, but nevertheless, I wanted to check it. And so your arteries, what this is checking for is coronary artery disease, or atherosclerosis. So what atherosclerosis, sclerosed means hardened, okay? Athero means it's a gruel-like substance that's deposited in something. So atherosclerosis is where it's a thick substance that's deposited inside of your arteries, okay? And particularly your coronary arteries, the arteries that supply the blood to your heart muscle, not the arteries in your arm and the legs, but more your coronary arteries. And so if this test, it's a computed tomography test, and it actually determines if you have calcium in there and buildup, okay? And so there's a score. So there are 4 modalities to check for heart disease. One of them is the CT, this scan I'm talking about. The second one is your family history, okay? So you know what that is. The third is the C-reactive protein, and then the fourth is the ankle brachial index, which is a measure of your arm and your ankle blood pressure, okay? So, but if you want to get this test done, talk to your doctor about it. You may have already had it done, and yours may have been good. I hope it was, but that's just some information for you to know about heart disease. So it is the #1 killer of women. So this is how you can determine your risk with this CT calcium study. Now, tomorrow night, Lord willing, I'm going to talk about it's not cholesterol. I don't know if you watch Dr. Oz or are aware of what's going on, but there's a big switch going on in the health industry, okay, about cholesterol. Now, it's not getting out there really fast, and the reason is because the makers of statin drugs don't want it to get out. But there are some front-running cardiologists and doctors that are recognizing that the high cholesterol is not what it was always thought to be, and certainly not the low-fat diet is not it's not healthy. And I was just Googling, because a lot of times I'll Google about this #1 killer. I wanted to verify that statistic. And one of the things it said to do to lower your risk for heart disease is it's to eat the low-fat diet. Oh my gosh. I'm like, this was the CDC. This was from the CDC, a recent publication. And I'm just like, we are paying a big amount of tax dollars for that information, which is not proven. In fact, it's proven that it's not true. So yeah, I see all your likes. I mean, you gotta get with it. You gotta get yourself educated. So here, remember the lipstick? You don't know what you don't know. I didn't know that had a mirror on it, but once you know, then you grow, and then you can begin to adjust and understand that it's not the fat that is making us fat. It is the sugar. So tomorrow night, I'm going to talk to you about how sugar causes heart disease, okay? So join me tomorrow night. Give me your email. I'm Dr. Nancy Stanley, physical therapist and health coach. And go to my YouTube channel. This will be uploaded to YouTube soon, Dr. Nancy Stanley. Subscribe and hit that bell that you get notified when I do a new video, which is, I do one in the morning, but I don't always put those up to YouTube. Those are mostly on Facebook. But you got to get educated, folks. You've got to know, hey, knowledge is the key. You are right, Winona. You are doing so good. I'm so proud of you. So just know that there is a way to know, and it's a non-invasive way to know about the amount of plaque that you have in your heart. So I hope you'll know that. I hope you'll cook this meatloaf and this, if you want this. I've sent this out before, so I'm not going to send it out unless you request it. I'll send the, if you'll message me or text me your phone number or your email, I'll send you this. But really, I want to get your email because I want to be sending out emails to you. If you're not on my email list, then get on it. I hope you read my emails. There's a lot of good health information, mindset information in there. So I hope you have a great day, and we'll talk soon.